My name is Dr. David Brady. I'm the Vice Provost of the Division of Health Sciences at the University of Bridgeport and the Director of the Human Nutrition Institute. UB is a very unique place. We're not the typical health science division. We have a much larger diversity of programs at UB in that we combine many sort of standard or traditional health science programs, such as our dental hygiene program and our physician assistant program. But we also have programs from the other side of the spectrum, more in wellness or holistic or complementary medicine.
My name is Ann Lee. I'm a naturopathic student as well as an acupuncture student. Because it's a newer school, people here, professors, are a little more open-minded in the clinic, and they really want you to focus on practicing true naturopathic medicine. So that's what the environment that I was really looking for.
We are expanding our new teaching clinics. We have the new pediatric and autism clinic. We also have the new teaching clinic with Dr. Diadamo, who wrote the blood type diet book, Eat Right for Your Type. So students are going to have unique opportunities to work with physicians that have made changes in their field.
I'm Dr. Gio Espinoza, Director of Integrative Urology here at NYU Langone Medical Center. Back in the late 90s, I decided, well, you know, I want to be a naturopathic doctor. So then I started the program in late 99, early 2000. To be successful as a naturopath, you really need to work and work hard, but you need a good foundation. And that's exactly what UB offers, in my opinion, a very good foundation.
People who come into this program 4 years later, they are different people.
It's almost like a miracle in a sense. You come back to nature and I guess what it is to be a human.
The transformative process is to yourself, and by learning how to help others, a lot of students learn how to help themselves, and they really come out of school entirely different people.
I'm Dr. Christopher Good. I'm a professor of clinical sciences at the University of Bridgeport College of Chiropractic. You know, we're special for a number of reasons. We have very small classes, so you have a very intimate learning setting. You have a tremendous faculty, so you have individuals who have come from 9 different chiropractic colleges that are teaching our students.
You feel like a family here. It's not a place where there's hundreds of students in your class and you're with them throughout the day for 4 years. You know, I just feel like I formed a lot of bonds here that are going to last a lifetime.
We have the ability to integrate with the other healthcare professions because we have this health sciences program. And so that gives you exposure to, for example, naturopathy and acupuncture, nutrition.
Already being in the clinic and having an internship with an outside doctor, I've gotten to treat hundreds of people, which, you know, helps you.
And we're also in a big university setting, so that gives us the resources to help our students learn. For example, our library has tremendous resources both at the site itself and also through the internet. Our focus is on patient-centered care, and aligned with that is our focus on evidence-based healthcare. So our students are trained to look critically at the literature, to access the literature, and apply that to the patients, you know, that are sitting in front of them.
This is a very unique program because the University of Bridgeport is so unique, and that is that it offers integrative health care. So our students from the University of Bridgeport PA program are going to be exposed and have experience with all these other different healthcare fields, and there is not a PA program in the country that does that.
In addition, we are also adding a global health perspective to the program, which is really important at this point.
Basically, we're condensing medical school into 2 years. We can do in 24 months, 28 months, a very intensive program based on medical experience. We can turn out highly qualified healthcare practitioners.
We want students who have a strong desire to work with people.
It really expands their world.
The profession is growing. By 2016, I think that the profession is going to grow by 25%. That's tremendous.
I promise that they're going to learn a lot. They're going to work very hard, And when they leave, they're going to have good feelings about the program, and they're entering a profession that just continues to grow and offers a great deal of satisfaction to themselves and to their patients.
I was listening to the science of Dr. Jeffrey Bland, and I was reading the philosophies of Dr. David Brady. So as a dietitian with my private clientele, I ended up implementing some of their approaches. I was just amazed at the outcomes that I had with these patients. I just knew at that point that I needed to learn more.
It's become wildly popular. Now we have anywhere between about 250 and 300 students enrolled in the master's program in human nutrition at any given time. And I would say about 70% of those students are online students.
It is a challenging program. It is one that's going to ask them to use critical thinking as they start to learn the concepts and go through the program. And so we're looking for a student who's serious about taking nutrition into their profession.
We have students in Japan and Australia, all over the United States. And then we have about 30% of our students still come to campus and they attend our weekend program.
The instructors that they have are entirely dedicated to their success, and they will go overboard in every way possible to help them through the program and to broaden their knowledge base.
I'm Jerry Mullen. I am associate professor here at Johns Hopkins in the School of Medicine. I'm also director of the Integrative GI Nutrition Services here, and I came through the Bridgeport program back in the early 90s. I had a lifelong interest in nutrition, and Bridgeport was the only program that was allowing full-time workers to go and learn and to actually engage in a Master's of Nutrition program while you're working full-time. And while I was there, I actually encountered some really excellent professors who guided and mentored me along my career, and today I am one of the national experts in nutrition, and I felt that my experience at the University of Bridgeport was fundamental in my development, and I think that it's one of the most outstanding programs in nutrition that is out today in the country.
Well, I've been working in a community health center for 7 years as a dental assistant. I told myself that it was time for me to move on. I really wanted to work with patients because I saw there was a lot of people that were in need. So I wanted to come to UB.
The reason at this moment in time that University of Bridgeport and Fones School Dental Hygiene is the place to be is that we have just initiated our brand new state-of-the-art clinic where we're able to use the latest in dental hygiene technologies to instruct our students.
Dental hygiene is very intense, so you have to be very dedicated and responsible. One thing that I always remember is going into community. One of the rotations that I really liked was going into the nursing homes and being able to help those patients that really needed help.
Our clinical faculty, we follow the students from their very first day they walk through the door to the day that they graduate the program. They will be aware that they're able to achieve far more than they ever thought was possible. That's what UB can do for you.
I came into the program because I injured my ankle. I went to different medical fields and nothing was working. And so I went to the acupuncture clinic and I got better so much faster that I thought, this is what I want to study.
People talk about acupuncture as being holistic medicine, but I like to think of it as a ecological medicine. It's based on looking at the individual and how they fit into their environment, how they interact.
The Acupuncture Institute here at the University of Bridgeport trains our students in Western medicine to the same caliber as the naturopathic and chiropractic students, so that they learn the anatomy, physiology, pathology, and clinical diagnosis of a doctoral level student.
I think it's a really nice rounded program because you get to work a little bit on your energy, your relationship with yourself, and how your relationship with yourself is affecting the treatment that you do, because it is such a personalized treatment.
Our clinic is very busy. Quite often other schools have to double up students, et cetera, et cetera. We're actually on the other side. Students would never be at a loss for clinical experience.
It's great. It's another theory of medicine. It's another way of viewing the body and the pathology and everything. So it radically changes your way of seeing the world.
Patients want greater choices, and that's really the mission here at the University of Bridgeport. Our programs are really focused on prevention, wellness, and options in healthcare.